the perceived experiences of racism can have a negative effect on people's health. And so there's a special word that they use. It's called the allostatic load. And what that means is that the experiences, the stresses of experiencing racism continue to pile on each other. And so that's what we mean by the load. Like it just keeps loading and loading and loading, and it has been found to have negative effects on even sometimes the molecular level. There is the how your DNA replicates. It can even affect that, and that's what sometimes can lead people to have certain health issues. And so that is a real concern. It's not the only part that causes symptoms, but stress, as we know, in this pandemic, chronic stress, acute stress, can have a toll on the body. Because typically, when your body has a response to an acute issue, typically you're supposed to, complete a whole cycle of stress and come back to your baseline. But often we live in times where we continue to just stay in the stress response. And that creates inflammation in the body, that creates high blood pressure, it affects people's health outcomes. And so it is important to acknowledge that unfortunately that doesn't exist. And that was a reason, I'm sure this has been touched on before, that Black women who were college educated had higher maternal death rates than white women who did not graduate from high school. And so when you look at studies like that, all that's left is actually racism. So it's important as a primary care physician myself. I see a variety of patients. Of course, I have a lot of African American patients. I see all kinds of people from all kinds of walks of life. But I am aware that there can be this uneven toll that people feel based off of different demographics that they belong to. And so part of that, is that's even more reason to focus on health, to counteract the other parts that life brings us.
It's the truth.
And so the importance of the primary care physician is that we focus on preventing disease, we focus on treating chronic diseases, and then we also help patients navigate what can be a very convoluted healthcare system. Often when I have patients who might come in with a health issue that might be above my scope of practice and training, I'm still able to use my medical knowledge to figure out, okay, well, who else, what other specialty, what other aspects do we need to bring into this conversation as we try to figure out what's going on with this complex problem. So we deal with prevention, we deal with management, and we deal with coordination and just how to navigate overall healthcare.